Welcome to my Journey of the Eye by Dawn. The eye is divided into three chambers. We have the anterior chamber of the eye, the area between the cornea and the iris, the posterior chamber of the eye between the iris and the lens, and the vitreous chamber of the eye, which is behind the lens. The aqueous fluid flows from the posterior chamber to the anterior chamber. Aqueous is the fluid that is formed in the ciliary body. It flows through the pupillary space and into the anterior chamber. Eventually, the aqueous fluid passes through a filter called the trabecular meshwork, and then through a tiny canal in the sclera called the canal of Schlemm. The balance of this fluid is important because if the intraocular pressure, IOP, is elevated, the patient is at risk for glaucoma and damage to the optic nerve could occur. Cornea, the transparent dome-shaped protective layer of the eye. Its bulging curvature provides 2/3 of the refraction power for the eye. It is like a watch crystal, giving us a clear window to look through. Conjunctiva, thin, transparent tissue that covers the outer surface of the eye. It begins at the outer edge of the cornea and extends to line the inside of the eyelids. Conjunctivitis, or pink eye, is the inflammation of the conjunctiva. The inflammation causes the blood vessels in the conjunctiva to dilate, giving us a red bloodshot eye. Iris is the colored part of your eye. In my diagram, my eyes are green. The function of the iris is to control light input to the retina by either expanding to let light in a dark environment, or contracting to reduce the amount of light entering when in a sunny environment. Pupil, the round hole in the center of the iris through which light passes. It appears black. In my diagram, I drew it black, but technically it's just a hole. The next structure is the lens. The lens is a flattened biconvex transparent structure located behind the pupil. It has a diameter of about 10 millimeters and a thickness of about 4 millimeters. It's the size of a Smartie candy. The lens is held in position by the zonules. If the eye is relaxed, the zonules pull on the lens and it will have a flat shape. The focusing is weak. If the lens needs to focus, then the tension is released and the lens take on a bulbous shape. The zonule fibers are controlled by the ciliary body, which contains muscles that control the fibers. It also produces the aqueous humor mentioned earlier. Before I discuss where the lens is located, which is behind the iris, and its size and function, I'd like to talk about a disorder that can happen to the lens, a condition that can happen to the lens. It can be congenital, it can be due to a trauma in a young child, an old child, and it can happen later in life. If the lens becomes cloudy to the point that vision is affected, then we say that the patient has a cataract. There are 3 different types of cataract surgery. We're going to only discuss one. The other 2 are really evasive, and this would be in people who had either a trauma, like an accident, or a severe cataract. Most cataract surgery is a 30-minute outpatient surgery, and the procedure is called phacoemulsification. The first step in that surgery is with an operating microscope. There's an incision is made in or near the cornea of the eye, and then an ultrasound probe is inserted into the eye. And the ultrasound probe is not a laser, even though patients say it's laser surgery. The probe uses ultrasonic vibrations to dissolve the part in the lens that's making it cloudy, to break up those pieces. Once they're dissolved, they're sucked back up the probe and removed. Now, in order to restore the focusing power of the lens, in adults, we're going to insert an intraocular lens, an artificial lens. And usually vision is restored so well that patients do not need glasses or maybe only slight reading glasses. In children, intraocular lenses are not recommended because the eyes change and grow. So it would take several surgeries over time because we'd have to keep replacing them with larger lenses as the eye grows. So if we cannot do the intraocular lenses, we're going to have to restore the focusing power by either contact lenses or glasses. It is common if a child has had a cataract that they've been using the other eye and that the brain has said it doesn't like the different vision in the two eyes. So it's only using the eye without the cataract. So it is common that you're going to have what is called lazy eye. And so now we're going to have other issues, and we might have to do some vision therapy and patching. So we can get the eye that has the cataract removed to work. And so together we can have great vision in that child. The area behind the lens is the vitreous chamber. The fluid that fills this chamber is called the vitreous humor. It comprises a large portion of the eye. The clear, jelly-like substance is located behind the lens and before the retina. It must remain clear enough for light to pass through. Unlike the aqueous humor, it is not actively regenerated or replenished. If a substance, known as a floater, enters the vitreous humor, it will remain suspended until surgically removed. The oral serrata is the serrated junction between the retina and the ciliary body. Looking at the eye, it looks like squiggly lines between the two sections. The retina is the multi-layered sensory tissue that lines the back of the eye. It contains millions of photoreceptors that capture light rays and convert them into electrical impulses. These impulses then travel along the optic nerve to the brain, where they are turned into images. There are two types of photoreceptors in the retina, rods and cones. The cones are contained in the macula. On the diagram, I drew with a multicolored pencil this area. It looks like blues and some purples. They are most densely compact in the fovea. It is the fovea in the fovea which provides high visual acuity. Now, a disease that it most likely affects our elderly population is macular degeneration. Statistically, this starts about age 60 and progresses quite rapidly through the 80 age group. Macular degeneration is age-related macular degeneration, is the one I'm talking about, is the leading cause of vision in Americans 60 and older. It destroys your sharp central vision. So unlike retinal pigmentosa that destroys your night and your peripheral vision, because this takes place in the macula, we're going to destroy our central vision. There's actually two types. There's wet AMD and dry AMD. The wet AMD occurs when abnormal blood vessels grow under the macula. This is rapidly degenerating. So it's common for people that have wet AMD to lose their vision quite quickly. It starts as blurry vision. That's some of the early symptoms. The other type is called dry AMD. It happens when light-sensitive cells in the macula break down. This one is more gradual, and you gradually lose your central vision. The early symptoms of this type are when you look at a straight line and it appears to be crooked. We talked about the cones, the cells in the retina, and macular degeneration, and the fovea. Those all have to do, the cones have to do with color vision. There are other cells inside of the retina are called the rods, and they have to do with night vision and peripheral vision. They are scattered throughout the retina, and they're very important. If someone is having trouble with night vision, it may be time to look into some of the conditions that can happen to the retina as far as the rods. Retinal pigmentosa is one of those disorders. Basically, it's the dying off of the retina. You'll get these dark spots in the back of the retina, and slowly the peripheral vision and the night vision are affected by this. The next structure is the optic disc. It's the round area in the back of the eye where the retinal nerve fibers collect to form the optic nerve. The optic disc is known as the blind spot because it contains no photoreceptors. Any light focused on it cannot be converted to sensory impulses. The choroid lies between the retina and the sclera. And on the diagram, this is the black thinner line between the polka dotted retina and the white sclera. It is actually dark, and it's darker in darker pigmented people. Caucasians seem to have a lighter choroid, which makes sense because the pigment all over is light. The choroid, the darkness and the choroid come around and converge at the front of the eye to form the iris, which is also colored and has melanin pigment. The diagram I saw, it was more like a dark blue, but in my diagram it's black. But when I saw it on a picture, it looked quite dark blue. It contains blood vessels that nourish the back of the eye. The choroid connects with the ciliary body toward the front of the eye, which is where the iris is, and is attached to the edges of the optic nerve at the back of the eye. So it kind of goes around the eye. The sclera is the outermost layer around the eye, and it's also more of a thicker fibrous material. It's white and opaque. It's the white opaque membrane of the eye. It's known as what's known as the white of the eye. The muscles that control eye movements connect to this part of the eye. And at the back, it's attached to the optic nerve. Thank you.